Introduction and why blood pressure control is important for seniors. In recent years, high blood pressure, also known as hypertension, has become a major health issue, especially among the elderly. As people age, the body undergoes natural aging processes, one of which is the change in the function of the circulatory system, particularly blood pressure. High blood pressure is not only a concern for younger individuals, but it also becomes increasingly prevalent among seniors due to the decreased elasticity of blood vessels and changes in various organs that come with aging. Blood pressure is the force of blood against the walls of the arteries as the heart pumps. Normal blood pressure ensures the proper functioning of the body, supplying oxygen and nutrients to organs effectively. However, when blood pressure rises too high, it forces the blood vessels to work harder, increasing the risk of severe health conditions like stroke, heart disease, kidney disease, and cognitive decline, all of which significantly impact the quality of life for the elderly. In this article, we will explore the importance of maintaining stable blood pressure in seniors, the risks associated with high blood pressure, and effective methods to help the elderly maintain their blood pressure within a safe range. Why is blood pressure control important for seniors? 1. High blood pressure and its risks for seniors. High blood pressure often has no obvious symptoms in the early stages, making it difficult for many individuals to recognize the hidden dangers. When blood pressure is not properly controlled, it can lead to numerous serious health problems. For seniors, high blood pressure can contribute to cardiovascular disease. As people age, the heart becomes less efficient. High blood pressure puts excessive pressure on the heart, causing it to work harder to pump blood. This can lead to heart attacks, heart failure, or arrhythmias. Stroke. When high blood pressure persists, it can damage or rupture the blood vessels in the brain, causing a stroke. A stroke can severely affect movement and cognitive functions, significantly reducing the quality of life. Kidney disease. High blood pressure can damage the blood vessels in the kidneys, impairing their ability to filter blood, which may lead to kidney failure. The kidney's inability to function properly worsens high blood pressure, creating a vicious cycle that is hard to control. Cognitive decline. Studies have shown that high blood pressure can affect brain function, increasing the risk of Alzheimer's disease and cognitive impairment, which further impacts movement and balance. For these reasons, controlling blood pressure is crucial for protecting seniors' health. Maintaining stable blood pressure reduces the risk of these severe health problems, thus improving the quality of life for older adults. 2. How aging affects blood pressure. With aging, the blood vessels naturally become less elastic, which can cause blood pressure to rise. Additionally, some organs in the body, such as the kidneys and blood vessels, become less effective at regulating blood volume and fluid balance, contributing to increased blood pressure. For seniors, factors such as hormonal changes, decreased blood pressure regulation, and weakened circulatory systems are the main contributors to high blood pressure. Other factors such as a sedentary lifestyle, poor dietary habits, eating too much salt, not enough potassium, long-term stress, and obesity also increase the risk of high blood pressure among the elderly. Thus, high blood pressure is not only a natural consequence of aging, but also a result of lifestyle choices that can be addressed through proper management. 3. Impact of high blood pressure on quality of life. Seniors with high blood pressure often experience a variety of health problems that reduce their quality of life. Difficulty with physical activities. High blood pressure increases the strain on the heart and other organs, leading to fatigue, shortness of breath, and chest pain, which limits mobility and daily activities. Social limitations. When blood pressure is uncontrolled, seniors may find it difficult to engage in physical activities, social events, or family gatherings, leading to isolation and feelings of depression. Disability risk. If high blood pressure leads to a stroke or other cardiovascular problems, it can result in disability, making it harder for seniors to care for themselves. This reduces their independence and quality of life. 4. Controlling blood pressure helps prevent complications. Controlling blood pressure not only helps prevent the health issues mentioned above, but also ensures that seniors maintain overall good health. Stable blood pressure reduces the risk of stroke, heart disease, kidney disease, and cognitive decline. Furthermore, seniors with controlled blood pressure tend to feel healthier, experience less stress, and have an improved mood, allowing them to live a more independent and happy life. Methods to control blood pressure for the elderly. High blood pressure, hypertension, is one of the most common and serious health issues among the elderly. This is a silent condition with no obvious symptoms in its early stages, but it can lead to dangerous complications such as strokes, heart disease, kidney failure, and memory decline. However, with effective blood pressure control methods, the elderly can significantly reduce these risks and improve their quality of life. In this section, we will explore effective methods for controlling blood pressure in the elderly, including lifestyle changes, dietary adjustments, and self-care practices. 1. Adopting a healthy lifestyle. Maintaining an ideal weight. Excess weight is a significant risk factor for high blood pressure, as the heart has to work harder to pump blood throughout the body, increasing pressure on the blood vessels. In particular, abdominal fat is a major risk factor for the elderly, as it can reduce the elasticity of blood vessels, leading to high blood pressure. To control blood pressure, elderly individuals should maintain a healthy weight through regular physical activity and a balanced diet. A healthy eating plan combined with light exercises such as walking, swimming, or yoga can help reduce weight and keep blood pressure stable. B. Regular exercise. Exercise plays a crucial role in controlling blood pressure. In fact, individuals who maintain regular physical activity tend to have a lower risk of high blood pressure than those who are sedentary. Specifically, exercise helps improve cardiovascular function, boosts blood circulation, and reduces stress. The elderly can engage in gentle activities such as walking, cycling, swimming, or stretching exercises. It is important to consult a doctor before starting a new exercise program to ensure the exercises do not negatively affect their health. C. Stress management. Chronic stress is one of the leading causes of high blood pressure. Stress hormones like cortisol can increase heart rate and constrict blood vessels, leading to high blood pressure. Elderly individuals are often more susceptible to stress, especially when dealing with health issues or the loss of loved ones. Stress-reducing activities such as meditation, deep breathing exercises, yoga, and relaxing activities like listening to soothing music or reading can help control blood pressure. These methods not only reduce blood pressure, but also promote a sense of calm and well-being for the elderly. 2. Healthy diet. Diet is a key factor in controlling blood pressure. A proper diet can help the elderly lower their blood pressure, protect their heart, and improve their overall health. Reducing salt intake. One of the primary contributors to high blood pressure is excessive salt in the diet. Salt can increase the amount of water in the body, putting pressure on blood vessels and the heart. Elderly individuals should limit their salt intake and avoid processed foods that are high in sodium, such as canned foods, fast food, and prepackaged snacks. According to health experts, the elderly should consume less than 2,300 milligrams of salt per day, about 1 teaspoon. To reduce salt in meals, it is recommended to use natural seasonings such as garlic, onions, pepper, or herbs. B. Increasing the intake of vegetables and fruits. Vegetables and fruits provide a wealth of fiber, vitamins, and minerals that help maintain stable blood pressure. Leafy greens like spinach, kale, and fruits such as bananas, apples, and oranges are rich in potassium and magnesium, essential minerals for blood pressure regulation. In addition, these vegetables and fruits also provide antioxidants that protect blood vessels and the heart from free radical damage, reducing the risk of atherosclerosis and other cardiovascular diseases. C. Limiting saturated fats and cholesterol. Saturated fats can raise the levels of bad cholesterol, LDL, in the blood, leading to plaque buildup in the blood vessels and causing blockages. This increases blood pressure and the risk of heart disease. Elderly individuals should limit their intake of foods high in saturated fats such as red meat, butter, cheese, and processed foods. Instead, they should opt for unsaturated fats found in foods like olive oil, nuts, and fatty fish like salmon and mackerel. D. Eating more omega-3 rich foods. Omega-3 fatty acids are unsaturated fats that help lower blood pressure and protect the cardiovascular system. Omega-3s reduce inflammation and lower LDL cholesterol levels in the blood while improving blood circulation. Omega-3 rich foods include fatty fish such as salmon, mackerel, sardines, and chia seeds. If it is difficult to consume enough omega-3 from food, elderly individuals can supplement with omega-3 capsules after consulting with their doctor. 3. Taking blood pressure medications if necessary. In some cases, when lifestyle changes and dietary adjustments are not enough to control blood pressure, the elderly may need to take medications to aid treatment. Blood pressure-lowering medications are typically prescribed by doctors based on the patient's blood pressure condition and other risk factors. Common medications for controlling blood pressure include diuretics, help reduce the amount of salt and water in the body, decreasing blood volume and blood pressure. ACE inhibitors, help dilate blood vessels and lower blood pressure. Beta blockers, help reduce heart rate and lower blood pressure. Calcium channel blockers, help dilate blood vessels and reduce blood pressure. Medication use should be closely monitored by a doctor, especially in the elderly, as they may experience side effects from the drugs. 4. Regular blood pressure monitoring. An important method for effectively controlling blood pressure is regular monitoring. The elderly should check their blood pressure regularly at home using an automatic blood pressure monitor or visit healthcare facilities for regular checks. Monitoring blood pressure helps detect early changes and allows for timely adjustments in treatment. Additionally, recording blood pressure results and discussing them with the doctor helps patients understand their health condition and maintain stable blood pressure. Interview with the doctor about blood pressure and effective control methods. High blood pressure, also known as hypertension, is a common and serious health issue among the elderly. It not only affects heart health but also contributes to other diseases such as strokes, kidney failure, and even memory loss. To understand more about blood pressure and how to effectively control it, we had an interview with Dr. Nguyen Minh Tong, a cardiologist with over 15 years of experience treating hypertension and related health conditions. Question: Doctor, how does high blood pressure affect the health of the elderly? High blood pressure is a very serious condition, especially for older adults. When blood pressure is high, the heart has to work harder to pump blood through the arteries, which creates a lot of pressure on the artery walls. Over time, this can lead to damage to the blood vessels, causing arteriosclerosis and reducing the ability to deliver oxygen and nutrients to vital organs. High blood pressure also increases the risk of complications such as heart attacks, strokes, and kidney failure. As we age, the structure and function of blood vessels change, which makes elderly people more prone to hypertension. In addition, other health issues like diabetes, obesity, or high cholesterol can also contribute to the risk of developing high blood pressure in the elderly. Question: So, doctor, could you share some ways to control blood pressure for older adults? Controlling blood pressure is a long-term process that requires a combination of lifestyle changes and medication, if necessary. Here are some basic and effective methods to control blood pressure. Healthy lifestyle changes in diet. Older adults need to follow a healthy diet and reduce salt intake in their daily meals. Processed foods and fast foods are often high in salt, which can contribute to increasing blood pressure. Foods rich in fiber such as vegetables, fruits, and whole grains can help lower blood pressure. Additionally, potassium-rich foods like bananas, potatoes, and legumes help balance sodium levels in the body, which can also lower blood pressure. Regular physical exercise. Maintaining a regular exercise routine such as walking, swimming, or yoga can improve blood circulation, reduce stress, and help control blood pressure effectively. Older adults should start with light exercises and gradually increase the intensity as the body adapts. However, it is important to consult a doctor before starting any exercise program. Stress management. Stress is a major factor that raises blood pressure. Relaxation methods such as meditation, deep breathing, or listening to calming music can help reduce stress. Older adults should create time for relaxation and avoid stress factors in their daily environment. Weight loss if necessary. If an older adult is overweight or obese, losing weight can significantly help control blood pressure. Even losing a few kilograms can lower blood pressure. A balanced diet combined with exercise can help maintain an ideal body weight. Taking medication as prescribed by a doctor. In some cases, lifestyle changes alone are not enough to control blood pressure, especially for older adults with other underlying health conditions. In these cases, doctors may prescribe blood pressure-lowering medications. These medications include diuretics, ACE inhibitors, beta blockers, and calcium channel blockers. Medication use should be closely monitored by a doctor to adjust dosages accordingly. Regular blood pressure monitoring. Older adults need to monitor their blood pressure regularly, at least once a month, and more often if blood pressure is unstable. Keeping track of blood pressure readings and consulting with a doctor will help adjust the treatment plan effectively. Question: So, doctor, when should older adults seek medical attention for high blood pressure? For older adults, if blood pressure remains above 140/90 mmHg for an extended period, they should consult a doctor immediately. Additionally, if they experience symptoms such as headaches, dizziness, persistent fatigue, or other signs like chest pain or shortness of breath, they should go to the hospital to check their blood pressure and other related conditions. It is important for older adults not to stop taking medication or change the dosage without consulting a doctor. Blood pressure treatment requires persistence and following the prescribed plan to ensure its effectiveness. Question: Do you have any advice for older adults to maintain stable blood pressure and live healthily? I always advise my patients that controlling blood pressure is not a short-term battle. It's a lifelong habit. In addition to medication and lifestyle changes, older adults need to maintain a positive attitude, live joyfully, and avoid stressful factors. They should always follow a healthy routine, eat well, and exercise regularly. It's also important to consult a doctor before making any major changes in lifestyle, ensuring healthy blood pressure for elderly people. As we conclude this discussion on how to manage blood pressure effectively in older adults, it is crucial to understand that high blood pressure or hypertension is not just a single health issue. It is a multifaceted condition that can affect nearly every aspect of an elderly person's life. Hypertension can go unnoticed for years and silently damage organs, leading to strokes, heart disease, kidney failure, and cognitive decline. As the global population ages, the importance of managing and preventing hypertension in older adults has never been more critical. Through this exploration of methods to control blood pressure, we have seen how essential it is for older individuals to embrace lifestyle changes, monitor their health regularly, and adhere to doctor-prescribed treatment. But more importantly, we have come to understand that managing blood pressure in the elderly is not just about taking medication. It's about a holistic approach to health that includes diet, exercise, stress management, weight control, and regular monitoring. The importance of early detection and regular monitoring. High blood pressure often doesn't show any symptoms, especially in its early stages. This silent condition can persist for years without being detected, which is why regular blood pressure checks are so vital, especially for seniors. Early detection allows for timely intervention, reducing the risk of long-term complications. Older adults should aim to have their blood pressure checked at least once every 6 months or more frequently if their blood pressure is unstable, or if they are taking medication to control it. Regular visits to the doctor ensure that adjustments to the treatment plan are made as needed. Alongside regular checkups, seniors should monitor their blood pressure at home, using a reliable blood pressure cuff. Home monitoring helps track changes in blood pressure, provides insights into the effectiveness of treatment, and gives seniors a sense of control over their health. This can be especially useful for those who may experience white coat syndrome, where blood pressure readings are temporarily elevated due to anxiety during a doctor's visit. Lifestyle modifications for blood pressure control. One of the primary methods to control blood pressure is through lifestyle changes. The impact of these changes cannot be overstated. In fact, even modest changes can significantly reduce the risk of hypertension and lower existing blood pressure. For older adults, it is important to tailor these changes to their specific needs and limitations. Dietary adjustments. A healthy diet is crucial in managing high blood pressure. The DASH, dietary approaches to stop hypertension diet, has been proven effective in reducing blood pressure. It emphasizes the intake of fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Reducing sodium intake is especially important. The American Heart Association recommends a maximum of 1,500 milligrams of sodium per day, but most people consume much more. For seniors, reducing salt in meals, avoiding processed and canned foods, and choosing fresh, whole foods are effective strategies. Potassium is also a key player in blood pressure regulation, as it helps balance the negative effects of sodium. Foods like bananas, spinach, potatoes, and avocados are excellent sources of potassium. Additionally, reducing alcohol consumption and cutting out caffeine can help manage blood pressure. Physical activity. Exercise plays an essential role in lowering blood pressure. For seniors, engaging in low-impact activities such as walking, swimming, or cycling can promote cardiovascular health and help manage hypertension. Regular exercise helps improve circulation, reduces weight, and strengthens the heart, all of which contribute to better blood pressure regulation. The CDC recommends at least 150 minutes of moderate-intensity aerobic activity per week for older adults. However, it's important to consult a doctor before starting a new exercise regimen, especially for those with other health conditions. In addition to aerobic exercises, strength training and flexibility exercises, such as yoga or Tai Chi, are beneficial for overall health and can help manage blood pressure by improving muscle tone, balance, and stress levels. Stress management. Stress is a known contributor to high blood pressure, and managing stress is an important component of controlling hypertension. Seniors often face unique sources of stress, such as financial concerns, loss of loved ones, or health problems. Incorporating relaxation techniques into daily routines can have a positive impact on both mental and physical well-being. Practices such as deep breathing exercises, meditation, mindfulness, or simply spending time in nature can help lower stress levels. Socializing is another way to reduce stress. Isolation is a common issue among older adults and can lead to increased stress and depression. Encouraging elderly individuals to engage in community activities, visit friends, or join support groups can help them feel connected and reduce stress. Weight management. Obesity is one of the major risk factors for hypertension. Carrying excess weight puts additional strain on the heart and increases the risk of developing high blood pressure. For older adults, maintaining a healthy weight can significantly reduce the burden on their cardiovascular system. Adopting a balanced diet and engaging in regular physical activity are the two most effective ways to manage weight. Even losing a small amount of weight can make a big difference. A 5 to 10% reduction in body weight can help lower blood pressure and reduce the need for medication. For seniors who find it challenging to lose weight, seeking guidance from a nutritionist or joining a weight loss program designed for older adults can provide additional support. Medication for blood pressure control. While lifestyle changes are essential, they may not always be sufficient, especially for those with severe hypertension. In such cases, doctors may prescribe antihypertensive medications. These medications come in several different classes, including diuretics, ACE inhibitors, calcium channel blockers, beta blockers, and angiotensin receptor blockers, ARBs. Each class of medication works in a different way, and the choice of medication depends on the individual's overall health, other conditions, and how well the blood pressure is controlled. For elderly individuals, it is important to take medications exactly as prescribed, and not to stop taking them without consulting a doctor. Sometimes the elderly may experience side effects from certain medications, such as dizziness or fatigue. If these occur, it is crucial to speak with a healthcare provider so adjustments can be made. It's also important for seniors to understand the importance of adhering to their medication regimen, as untreated hypertension can lead to serious complications. The role of support systems in managing hypertension. Managing high blood pressure in older adults often requires a support system to help maintain motivation and consistency. Caregivers, family members, and friends can play a vital role in reminding seniors to take their medication, monitor their blood pressure, and engage in healthy lifestyle practices. Regular check-ins, offering encouragement, and participating in physical activities together can make the journey of managing hypertension more manageable and less stressful. Additionally, healthcare providers should work closely with their elderly patients to develop an individualized treatment plan that considers the patient's specific needs, preferences, and limitations. This collaborative approach can lead to better outcomes and ensure that seniors feel supported throughout their blood pressure management journey. Long-term benefits of proper blood pressure management. Properly managing blood pressure is not just about avoiding the immediate dangers of hypertension. It also offers long-term health benefits. When blood pressure is well controlled, older adults can reduce their risk of stroke, heart disease, kidney failure, and dementia. By adopting a healthy lifestyle and adhering to prescribed medications, seniors can improve their quality of life and enjoy their later years with greater independence and vitality. In conclusion, Controlling blood pressure in older adults requires a multifaceted approach that involves lifestyle modifications, regular monitoring, adherence to medication, and the support of a healthcare provider. The good news is that with the right tools and knowledge, high blood pressure can be controlled, allowing seniors to live longer, healthier, and more fulfilling lives. Regular checkups, maintaining a balanced diet, staying active, managing stress, and seeking medical help when necessary can ensure that older adults remain healthy and free from the long-term complications associated with high blood pressure. By prioritizing these practices, elderly individuals can effectively manage their blood pressure and lead a life full of vitality and joy.